Hello and welcome to Healthy Minutes, the program that talks about your health. I'm your host, Dr. Mo. Today, plastic surgery is becoming increasingly popular. We want to look better or change a few features in ourselves that we are not particularly fond of. And thanks to the constant upgrades in medical technology and trends in aesthetic procedure, this is becoming increasingly easy and popular. And one of the procedures topping that list is liposuction. Now, according to different polls, liposuction is one of the top 3 aesthetic procedures that people undergo. This body contouring procedure has undergone constant upgrades during the past decade, but the gist of it remains removing unwanted fat cells from our body. But how does it work? And are you the right candidate? We sat down with consultant plastic surgeon Dr. Gomes, who answered all our questions.
Liposuction is a body contouring operation. So basically we're just giving shape of the body depending whether it's a female anatomical or a male anatomical shape. It's got nothing to do with massive weight loss. Now the problems with massive weight loss are totally different. Liposuction generally doesn't, it's just for little body contouring with respect to massive weight loss, but then there are other different surgeries for post-massive weight loss. It's removal of fat in a very particular, precise manner so that we can recreate what is the ideal contour. And you must have heard of this term known as the profiloplasty, that is from the side view of a male or a female to give them that ideal profile. And we have gone one step further in liposuction, which is known as the 3D or the 4D liposuction, where we are not only doing body sculpting, but we are also adding fat augmentation. So for example, in a male who wants a good upper body, so we do a little fat augmentation where you would have your pecs or pectoralis muscles, and we remove fat from the lower so that they get those nice cuts on the side. We remove fat from this diamond shaped area so they get that shape. Similarly on the arm, so you want your deltoids to be elevated, you want that cut in the center. So this is a combination of contouring as well as fat augmentation to give this, and this is the newest trends within body contouring. So in the past, right, when they really started it, they used to do a dry liposuction where they would just put the cannula inside. Cannula is like a long tube which they put it under the skin, and they would connect that to a vacuum suction, and they would pull out the fat and pull out a lot of blood. So liposuction got into disrepute because there was a huge amount of blood loss, a lot of bruising, and probably a lot of morbidity and mortality. Then came a dermatologist, Klein, who developed this Klein formula, and we moved from a dry liposuction to a wet liposuction and a tumescent liposuction. And the Klein formula is used even today, where we do a tumescent liposuction where your bruising levels are reduced remarkably, your pain levels are reduced remarkably, even post-operative. And the most important thing is you can do it under local anesthesia. So some areas, within reason, you can do under local anesthesia, but if you're doing large amounts of liposuction, it's better to do it under regional or general anesthesia. Having said that, so this is the ordinary liposuction. Then they added a power-assisted liposuction, as in the cannula was mounted on to make it simple, or to describe it in a very simple way. The cannula is mounted on a machine which would make the cannula oscillate, go up and down or reciprocate, and that would reduce the amount of work that the surgeon has to do. So as the surgeon takes his hand forward, that cannula is going forward, up and down at a very high speed. So that is a power liposuction. Then we have a liposuction that we use is known as the body jet liposuction, where at the time of the liposuction there's a jet of fluid, a jet of saline which breaks down the fat, and at the same time suction happens. And this helps to break down the fat without damaging blood vessels, damaging nerves. After that, we have the ultrasonic liposuction, where you use ultrasound or focused ultrasound, which breaks down fat. And then came the laser liposuction, which we use, and the laser is a particular wavelength laser which breaks down the fat. And there's another plus point of laser liposuction is that it gives thermal energy to the undersurface of the skin, that's in the collagen layer. And this thermal energy causes a remodeling of collagen. So where you have skin which is a little bit in excess, removal of fat is going to make that skin droop more. So when you do a laser liposuction, not only are you melting the fat and then you remove the fat with something else, but you see 2 months later that skin retracts and that skin tightens. So arms tighten, the neck tightens, so you get a better post-operative contour. All right. Now what is coming to the market, and from the second generation or third generation, VASA is something which is well known, and that is focused ultrasound or ultrasonic liposuction, but it doesn't damage the fat so much, so you can use that fat for fat grafting. Okay, laser would damage the fat, so you cannot use that fat for. So we use a combination of body jet liposuction when we want to harvest fat for liposuction for fat grafting, and we use laser liposuction when we want skin tightening. So this is the combination, and very soon we'll be going into VASA, which will allow us to do 3D and 4D liposuctions. So you want a person who is about 30% within ideal body weight, and that's a person you can give the best result. Now you're not going to get all your patients in that category. So those who are a little overweight, yes, you tell them reduce a bit, come, you'll get the best amount of the result that you would see. Now, why do I say that? Because there's a defined amount of fat that one can remove. You just can't remove as much fat as you want. After a while, you'll have a lot of blood coming out into your cannula, and you don't want to remove any blood. So, so that's the reason why the patient should be not overly fat. If a patient is overly fat, then they go for bariatric surgery. But these are the patients. Now, I have another category of patients. They come to me and say, "Doctor, I don't want to do bariatric surgery. I'm going to do a diet and I'm going to do exercise, but I want something to just kind of, give me that thrust." So then I will do a liposuction, telling them, "Listen, I'm just going to remove about, say, 6 to maybe 7 liters or 8 liters of fat, but after that you have to go to do your diet, your regime, as well as your exercise program." What happens to my fat? Does the fat go to another place? Now, because of that, every case, like even today's patient, we take the fat which is removed and we send it to the room, so they see that fat for 2 reasons. They know that I've removed the fat, and 2, they look at it and see how gory it looks, and they do not, binge eat or go to fast food, etc. Of course, in order to maintain your result, which you see by about 1.5 months or 2 months, that's when you see your result. In order to maintain it, you've got to live healthy. You've got to stress on eating well and some sort of exercise. May not be every day, but 4 times a week is fine. And on an average, I would say about 80% of patients do not relapse. Now, coming to this question of where does that fat go? That fat has gone into the bucket, it's been thrown out. But we need to keep some fat in that area, otherwise your skin is going to necrose. So there's a thin layer. If you do a pinch thickness at that level, it'll be about a centimeter and a half. Now, post-operative, if you put on weight up to, say, about 7 kilos or 10 kilos, your fat cells over the rest of the body are going to become bigger, and therefore you're going to show fat in the rest of your body. But if it's over 12 kilos or so, the area where you've done liposuction is also going to start looking bigger, because there are fat cells there and they're going to accumulate adipose, and that's going to become a greater adipose tissue, and that's going to show as a poor contour there also. Well, let's start with the sequelae that's going to be seen in most patients. There's going to be bruising, there's going to be swelling. There are some patients who have a problem with any with marks on the body as they kind of pigment. So the areas where you enter from, those areas you may see as a little darker areas or dark scars. So these are common that you see, but the things that can be that we can call complications are most often they happen with people who are not trained to do this procedure. And I think training is essential in any walk of life. You want to do a procedure well, whether you're a doctor, an engineer, or what have you, you have to be trained. More so in our field, where we are looking at giving, basically aesthetic surgery is improving a normal person, a normal body. It's not a sick body which you're trying to heal, right? So you have to make sure that you're properly trained before you do any procedure in aesthetic surgery. Complications that can arise are asymmetries. You have removed too much on one side compared to the other side, or you've removed so much that some skin has necrosed off, or you've got depressions which are far deep where you have to do a fat grafting later on, or you've not examined the patient properly, there's a hernia and you've gone into the hernia, gone intraperitoneal. So these are things that can happen. So you've got to evaluate your patient beforehand. Most often, I would say, I wouldn't term this as a complication, but I would say patients are dissatisfied because you haven't done enough. Or you've picked up a patient who is not a candidate for liposuction. So he or she is not going to be happy with liposuction. It depends on the area that you're doing. If it's a small area, if a person says, I want local anesthesia, and it's a big area, I would say, okay, subdivide it into smaller areas, do 3 sessions and do each one under local anesthesia. But if you want to do the entire area and you're a candidate you're ASA category 1 where your risk is very low, yes, you can do it under general anesthesia. You can do everything together. I would say go ahead, but make sure that you go to a person who's trained to do liposuction. Make sure you ask your doctor all the questions which are relevant. Ask him for his experience. And most people who do a lot of liposuction will have pictures to show you. And I also have a support group. So if you come to me and say, doctor, I'm very scared, can I talk to someone who's done it? Yes, of course. I have patients who will talk to you. So this will help you to get ready for surgery. Remember, there are some sequelae which you will go through, and there's a defined period. You're not going to see a result tomorrow. So it's going to take about 6 weeks to 2 months to see it, and I'm sure that you're going to be happy with the result.
You're watching Healthy Minutes with Dr. Mo.